The president is going to make clear that once the FDA approves of an emergency use authorization for vaccine availability to those the ages of 12 to 15, something that is expected as soon as next week, the administration is going to go full bore to make sure parents have the information they need, but also they push out the vaccines into that population. That population in total, about another 5% of the U.S. population, certainly something the administration wants to see if they can get vaccines out to as quickly as possible once it is allowed by the FDA. Again, that is expected next week. All of this kind of encompassing an all-of-administration effort that recognizes perhaps vaccinations are starting to slow a little bit. Still, millions are going out per day, but they need to continue to ramp up to try and reach the goals that they've laid out over the course of the last several months, guys.
Okay, Phil Mattingly, thank you very much.
All right, we are waiting for President Biden to speak about the pandemic. He's expected to announce those new numbers and the objectives. Let's go now to Dr. Johnathan Reiner. He's a CNN medical analyst. Dr. Reiner, this new number to reach 70% of adults in the U.S. with at least one shot, right now 56.6%. 8 weeks they've got to do this. Do you think it's possible or probable?
I do. Look, first of all, we're going to see approval for 12 to 15-year-olds very soon. That's 6% of the population. There are 20 million adolescents in that age group. And over the next several weeks, I think people are going to start to understand the true benefits of the vaccine. There are a lot of people who haven't yet gotten their vaccination because they're waiting to see how other people did. And I think we'll start to see the gaps fill in.
Dr. Reiner, you know what I think would be a game changer is if we continue to see more young people getting sick. I mean, right now, more young people are being hospitalized. That's something that we weren't seeing a year ago, okay? And so here are the numbers. I mean, obviously the age 5 years old to 17, 5 to 17, 2% of the people hospitalized are in that age range, okay? Obviously a very low percentage, but it's still growing every week. I mean, obviously we got to a point where we somehow became comfortable with older adults being hospitalized and dying in this country. If kids were getting sicker, that would change everything.
Well, many more young people are getting sick with the virus, in part because the virus has changed a little bit. The virus is more transmissible, and we have vaccinated really well the age group over 65. Over 80% of people in that demographic have had at least one shot, and very few people under the age of 20. And that's the opportunity for the virus. So, this is why we need to immediately vaccinate kids 12 through 15. We really need to get basically every parent on board with this. And then, hopefully by the fall, we'll be vaccinating kids from 6 months to 12 years of age, and we'll just put the rest of this fire out.
So this new goal, Dr. Reiner, that we're going to hear from the president happens at about the same time that New York, Florida, other states are lifting restrictions. Potentially we're going to see transmission rates start to dip because people are returning to outdoors activities. For people who are reluctant or hesitant about getting the vaccine, if they see these numbers, what for them in their mind should be the urgency to get that first shot?
This is what I would remind people who are reluctant to get their first shot. Right now, we're still averaging about 680 deaths per day in the United States. Every single one of those deaths is an unvaccinated person. Almost without exception, every one of the deaths now in this country is somebody who has not been vaccinated. What more incentive can I give you?
Dr. Reiner, I know that you have been outspoken about thinking that perhaps the CDC guidelines are a little too cautious. Currently, the CDC guidelines for fully vaccinated people, in terms of how they can behave outdoors, let me read it to you. You can gather or conduct activities outdoors without wearing a mask, except in certain crowded settings and venues. What do you wish the guidance was that they were giving?
I wish the guidance would tell vaccinated people that they're immune, because that is the truth. So the CDC updated the most recent statistics on the first 95 million fully vaccinated Americans. And out of that cohort, 95 million people there have been 9,000 symptomatic infections. That's 0.009%. So said another way, if you're vaccinated, you are 99.991% protected from getting sick with this virus. We also have data that shows that you're just about as well protected against asymptomatic infection. So I want vaccinated people to know that, yeah, you can walk around without a mask because you are not going to get sick and you are not going to get somebody else sick. You know, the problem is that the CDC has to give guidance that doesn't negatively impact people who haven't been vaccinated. And I think they're worried that if you tell vaccinated people you don't need to wear a mask, then no one will wear a mask. But the truth is, if you're vaccinated, you really don't need to wear a mask in public.
Dr. Reiner, we know from a senior White House official that what we're expecting the president to say in a little more than 20 minutes now is that there will be bolstering in response in rural communities, including sending vaccines directly to rural health clinics. We've seen the polls. We know the numbers. Is the problem that they don't have access to the vaccines or that they don't want it? I mean, if that's what the focus will be, is this the right strategy? And we'll hear more to get to that 70%.
It's different in different settings. But what I'll say is the most effective place to start putting vaccines would be in doctors' offices, actually in the doctor's office. So when you come for your visit and your doc or your practitioner asks you why you haven't been vaccinated and they educate you, you can get a jab right then and there. My colleague Lena Wen has been talking about this a lot. Getting vaccines to really primary care settings will go a long way because people trust their doctors, they trust their providers. And when you have them in the office, that's the time to give them the shot. And then we need to be creative. We need to get into churches and community centers, and we really need to talk to people and vaccinate them on the spot. That's the way we can, basically get to the people who are reluctant. The people who are deniers, nothing we can do will get to them.